Hi, I'm Dr. Brandon Elnekaveh at the South Florida Center, and today we're talking about female genital cosmetic surgery. Female genital cosmetic surgery is a growing field of plastic surgery where we enhance or rejuvenate the female genitalia. It includes operations like monsplasty, vaginoplasty or vaginal tightening, labiaplasty, fat grafting, and a combination of those procedures as well. Anyone looking to improve their aesthetics or sexual wellness is a candidate for female genital surgery. Labiaplasty is the most common procedure we do. It involves reshaping or shortening the labia minora. It can be done under local anesthesia or general, but typically done under local anesthesia as patients are very comfortable with this. A vaginoplasty or perineoplasty is a procedure where we tighten the vaginal canal, especially towards the entrance of the canal, which can be widened especially after pregnancy. Generally, patients undergo this procedure under general anesthesia, and they go home the same day. There are several minimally invasive procedures, such as PRP injections or filler injections into the G-spot that can improve sexual satisfaction as well. For a labiaplasty, we're really reshaping and shortening the labia minora. The first thing we do is figure out what technique works best for you, either the wedge technique or the trim technique, and it really has to do with your goals and what we feel is the right option for you. Once we figure that out, you come into the holding area. We'll give you some medications that help relax you, some numbing cream to put over the area, and then once you're comfortable, we'll take you to the operating room, prep you and drape you just as we're doing normal surgery. The only difference is you're going to be awake, and sometimes you fall asleep, sometimes we have a nice conversation, and eventually the procedure is done with ease and you get to go home the same day. You need to make sure that you have a pad over the area to collect for any oozing that might happen, some antibiotic ointment just for a couple days. Generally, in terms of pain medications, you need Tylenol, Advil, and really the most important thing is icing the area because that can give you a lot of pain relief and also improve the swelling and the bruising. So what can you expect in terms of recovery from female genital surgery? Number one, there's going to be no sex for about 6 weeks. Number two, certain activities like horseback riding or bicycle riding, you really want to avoid that for the same amount of time. And in terms of walking, jogging, usually that stuff is okay right away. When looking for a surgeon, I think it's really important to find someone that you very much trust, that is going to go through all the options for you and really find the best technique to get you to your final result. So if you're interested in having female genital cosmetic surgery, give us a call or visit our website, and I look forward to seeing you soon.